Colorectal cancer is the nation's third leading cause of death, cancer death in both men and women. Touro internal medicine physician Dr. Skyler Williams joins us now to talk about the importance of colon cancer screenings. Good morning, Dr. Williams. What are the big causes and what are the risk factors here?
Well, colorectal cancer, which is also more simply known as colon cancer, occurs when the cells that line either the colon or the rectum become abnormal and are growing out of control. The majority of these colorectal cancers actually arise from abnormal clumps of cells and growths in the colon or rectum called polyps. And these polyps over time can transform into cancer.
And when you say over time, it could be 5 years, it could be what, 15 years sometimes?
Oh, for sure, yeah. An average polyp can transform into cancer over several years. So that's why guidelines support that we do routine screenings for patients for colorectal cancer. In general, if you're at what we call average risk for colorectal cancer, that should begin at the age of 45. However, if you are at a higher risk for colorectal cancer for some other reasons, sometimes the screenings even start before that age.
But these are not generally genetic, correct? I mean, it could be diet, could be weight, that sort of thing, but you don't necessarily inherit this, if you will.
Yeah, well, there's several risk factors for colorectal cancer, and some really important ones to keep in mind. One, your personal family history, whether a family member has been diagnosed with colorectal cancer previously, and then two, your personal history, whether you've been diagnosed with inflammatory bowel disease, have had radiation treatment to the abdomen or pelvis, or even have been personally diagnosed with polyps or colon cancer in the past. All of these things can increase your risk of developing colon cancer, among some of the other things that you mentioned, including your diet, lifestyle, and how active you are.
So in terms, finally, then, of the importance and driving home the importance of getting the screening, I had a doctor suggest to me once, if you think about it, this is the only truly preventable cancer. The doctor finds the polyp, the precancerous growth, removes it, voila. I mean, but yet so many people are still dying of it.
Yeah, it's unfortunately with the pandemic, we are even further behind on screening for this for colorectal cancer, which, as you mentioned, is so preventable. I want to drive home that we have an abundance of screening tests available now for colorectal cancer, not just visual tests such as the colonoscopy, which most people know about, but also stool-based testings that can be done even in the comfort of your own home. So important to be screened, and if you're having trouble getting to the doctor or accessing them, talk with them about the different screening tests so that you can stay up on your healthcare prevention and that you're getting screened routinely.
And prevent this killing disease. All right, Dr. Skyler Williams from Touro, thanks so much.
Thank you so much.